Hi, I am Dr.Sasikanth Maddu, Senior Consultant, Plastic, Cosmetic, Craniofacial and Hand Surgeon. Diabetic foot ulcers. These are one of the very common problems that are faced by many people, and for which there are different opinions, and the understanding differs from various people to various doctors and various practitioners. So today we will understand what a diabetic ulcer is and how it happens. So diabetic foot ulcers are the small wounds that appear in foot of people who suffer from diabetes, especially long-standing diabetes. So what are the changes that occur in diabetes that lead to foot ulcers? So generally there are multiple components in diabetic foot changes. One is neuropathy. Neuropathy is damage to the nerves of the skin because of high sugar content in the blood. So this damage leads to loss of sensation. And similarly, damage to the blood supply or blood vessels, especially the micro blood vessels or capillaries that are within the skin or just beneath the skin of the foot. This is called microangiopathy. And these two together lead to formation of small wounds or ulcers because of breakdown of the skin. And this results in diabetic foot ulcers. So what does this thing, different problems do so that there will be a ulcer? So the neuropathy leads to decreased sensation. So this decreased sensation, what happens when it makes the person neglect the small wounds that occur while he is walking or doing some work, because he will not be able to know that there is a wound, and he will not see it, especially when it is in the sole. Similarly, because of microangiopathy, what happens? The blood supply to the distal most vessels, or the most smallest vessels in the foot, especially the capillaries, the blood supply will decrease. Because of that, there will be some amount of damage that occurs because of decreased oxygen supply to the skin, and that leads to the breakdown of the skin and ulceration. So these two factors together form ulcers. So what happens if these ulcers occur? Yes, any breach in the skin, it might cause the onset of infection, or it will cause the bacteria to enter into our body and cause infection. So that infection, the bacteria won't sit alone, sit idle and do nothing. They will spread into the surrounding normal tissues and gradually increase the size of the ulcer till the point that there is a lot of destruction of the skin and lot of pus discharge, and someone or the patient himself notices the discharge, and then he goes to the doctor for the treatment. So this is how the diabetic foot ulcers manifest. How do we tackle it? We tackle by doing a regular dressings and with antibiotics and the procedures called debridements when it is necessary. If it is quite big enough to cause damage to the skin, then we have to remove the dead tissues and infected tissues by a process called debridement. And after that, wound coverage. So this is what we do to tackle the diabetic foot ulcers when it comes to us.